Order number 1, administration of oaths.
Proceed.
Order number 2, communication from the chair.
Honorable members, you are aware that COVID-19 pandemic has interrupted the regular calendar of the 4th session of this county assembly. You are further aware that the Speaker of the County Assembly called for the resumption of regular session of this House in Kenya Gazette Notice number 3740, dated 29th May 2020. Honorable members, I therefore urge the honorable members and staff to follow the guideline on COVID-19 issued by the Office of the Speaker, which was communicated to all honorable members and staff for the smooth and orderly conduct of legislative business of the County Assembly. Thank you.
Order number 3, message. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motion. Order number 7, statement.
Honorable member representing
Thank you, Mr. Speaker, sir, for giving me this opportunity. I know it's not a statement day, but it is the prerogative of the Speaker. Mr. Speaker, as you rightly said, COVID-19 is a pandemic, and it is ravaging the whole world, and we are not exceptional. Mr. Speaker, my humble request is there are those honorable members who are traveling from high-risk zones from Nairobi. So I request the chair so that at least these honorable members are quarantined in their homes for 14 days or undergo a mandatory test, because health is paramount. Some of us have actually stayed the whole holiday here so that at least we avoid this pandemic. And we don't want the same to happen to us while we are here. So, Mr. Speaker, we need a direction on that. Thank you.
Thank you, honorable member. I think if you read the guidelines that was being given out by the Speaker and was being gazetted to Kenyan Gazette, order number 37-4, the statement that we make is very clear in that order. I think members who are traveling from high-risk areas are asked to undergo a test. And in that, if they have been tested positive, it is obvious that they will be taken to where they deserve, actually a quarantine area.
Mr. Speaker, from the guideline, it was written voluntary. Voluntary means I can opt not to test. And the whole of those guys who are coming, honorable members who are coming from Nairobi, might even opt not to test because of that risk involved. So we need actually further guidelines on that.
So, Honorable Majority Leader.
Mr. Speaker, I think the honorable member is in order, but according to me, Mr. Speaker, I believe even Mandera is among the high-risk areas. So there is no difference between Mandera and Nairobi and Mombasa today. If you look at the high-risk areas in the map, the data, we have 14 cases and a lot of other quarantine people who are in the isolation centers. So, Mr. Speaker, I think is not in order, and the Speaker has already given direction that any member who feels it's voluntary, he can go for testing. And I doubt whether Mr. Honorable Kula has gone for testing himself and is in Mandera. Thank you.
Thank you, Mr. Speaker. I'm Honorable Yakub, member representing the Erkale Ward. Mr. Speaker, can we first define the high-risk area? Unless we define which is this high-risk areas, Mr. Speaker, sir, because we don't know. According to the national data and figures, which is actually released by the Minister for Health every day, the area like Nairobi, Mombasa, and the surrounding areas are the risk areas. But I think Mandera is not such very risk because, Mr. Speaker, for the last 2, 3, almost 4 weeks, 1 month ago, there is no any positive cases, Mr. Speaker, sir. There is no positive cases in Mandera for the last 1 month. And the samples, and the department is continuing to send samples. One time mass testing has been done, and I think there is no positive cases. And Mr. Speaker, as at now, Mandera is not a very high risk area. It could have been in a very high risk, at least after every 1 week or daily or even monthly, you could have got some kind of positive cases, 1 or 2. Mr. Speaker, sir, I think the issue of curfew, the issue of lockdown in Mandera, which was imposed by His Excellency President Uhuru Kenyatta, has really contained the virus within the vicinity, and it is almost getting okay, Mr. Speaker, sir. And with this case, Mr. Speaker, Mandera is not high risk, but for those guys from Nairobi, Mr. Speaker, not only from Nairobi, I think as leaders, we must lead by example. I could have urged the office of the Speaker and the clerk to call the medical practitioners to come here so that all of us test voluntarily and we lead by example. What are you fearing? Mr. Speaker, do you know why we are saying this, Mr. Speaker, sir? People have pre-existing conditions. Some people have asthma. Some people have allergies, Mr. Speaker, sir. And we are unable to cough around, Mr. Speaker, sir. Tumeshinda kukohoa. Tukikohoa tu watu wanatuambia, Mr. Speaker, we have coronas. We have corona. Some people have pre-existing conditions like, do you know, very severe allergies to cold, to dust, and this. And they cough. If they cough, you are told you are suffering from COVID-19, Mr. Speaker, sir. To avoid all those doubts, Mr. Speaker, sir, let us do a mass testing for the assembly, including the staffs, Mr. Speaker, sir. And the Speaker must lead by example. Honorable Sura of the Clerk must lead by example, followed by the Deputy Speaker, the House Majority Leader, the House Minority Leader, the chairs, and other followers. And I think as a former medical practitioner, which is my profession, Mr. Speaker, sir, me and Honorable Kula can lead by example, Mr. Speaker, sir. We have nothing to fear, Mr. Speaker, sir. If we are positive, we are. There's no problem. We can quarantine ourselves, and it is good for us for the purpose of protection for our own self and for the protection of our families and the entire Mandarians, Mr. Speaker, sir. I rest my case. Thank you.
Adam. Thank you, Mr. Speaker, sir. Mr. Speaker, I do support the opinion that the members who come from high-risk areas tested. Because if I quote Mutahi Kagwe just 2-3 days ago, he was saying within your neighbors, check around anybody from Nairobi or Mombasa. If there's one, you have all the reason to worry. That Mutahi Kagwe. Mr. Speaker, because of be voluntary, it should be mandatory for members from Nairobi to test for coronavirus. And the other one, Mr. Speaker, is about the entire members of staff and members of the assembly to test. Here, Mr. Speaker, I have got a fear. The fear is that if you look at the stories around the country, you find a person is found positive. In 2-3 days, a person tests negative. They call it wrong negative, wrong positives. And from there, a conclusion was given by medical, or a direction was given by Mr. Akoth. This guy was telling us that the machines that we have could test anything, like any condition of the body, and relate it to coronavirus. So, Mr. Speaker, that one will create unnecessary, a fear in the House.
and it will hamper the business of the House, Mr. Speaker. The other thing, Mr. Speaker, the doubt has been raised by the countries around the world that the equipments that are used to, test coronavirus are 40% accurate. They are 60% inaccurate. So, Mr. Speaker, you will find 48 members of the Mandera County Assembly, 32 of them will test positive, when in actual sense, none among them is positive, and we put ourselves in fear and unnecessary, interruptions, Mr. Speaker. So, Mr. Speaker, I do, support the opinion that those members who come from high-risk area, which Mandera is not one of them, should test. It is for our own good. And the testing, Mr. Speaker, because of the factors I just mentioned, should not be a member is tested positive, negative. It should be tested and tested for this confirmation of this negative, wrong positive, wrong negative. Thank you so much.
Thank you, Mr. Speaker. Mr. Speaker, I have the same opinion with Honorable Kula and Honorable Yaqub, Mr. Speaker. Mr. Speaker, the last time Mandera County testing was done, as a chair for COVID, I can confirm the sample that was carried was 193 samples from all sub-counties and wards. Of the 193, Mr. Speaker, all tested negative. The last test that was done in Mandera County. Mr. Speaker, of the 18 patients that were in the isolation, currently we have 11, of which some of them in the first random test, they showed negative. And we hope in the second random test, they will show negative so that they will be discharged, Mr. Speaker. Bear in mind that, Mr. Speaker, we can confirm that we are not at high-risk areas. The last time Mandera reported case was 25 days to 1 month ago, Mr. Speaker. Mr. Speaker, if you were following this issue of the corona update in Kenya, nowadays the numbers are skyrocketing, 145, 135, 150, Mr. Speaker, and Nairobi is termed as high-risk area, Nairobi and Mombasa, Mr. Speaker. The last time, the first case in Mandera County, Mr. Speaker, was a transported case from Kilifi or Mombasa area, Mr. Speaker. I think it is accurate that, Mr. Speaker, those members who are from Nairobi should be tested, Mr. Speaker. Sometimes back, the newspaper reported that 17 members of National Assembly were positive. So, Mr. Speaker, we don't want our name to be maligned, Mr. Speaker. And if members are traveling from Nairobi, I think it is very accurate and appropriate for them to be tested. For our dignity and our name as an institution to be safe. With that, I support the opinion of Honorable Kula.
Honorable Speaker, for giving me the opportunity. Honorable Speaker, the coronavirus is real. No one knows who is the carrier of the virus, whether you are in Mandera or Nairobi or Nakuru or from Somalia, unless you test. Second, Mr. Speaker, as leaders, especially those of us who hold responsibility, Office of Speaker, Majority Whips, those of us, it is our responsibility to ensure the members are comfortable as they stay in the premises of the Assembly. You know, so much fear even is worse than the disease. From the look of the things, you feel that our members who are in Nairobi are less than 10. Majority are here. When we say they should be quarantine members, are suggesting only the fear that they have, but not that they are carriers of the virus. So I urge that we quarantine or such. We don't go for that way, but when they come, as through your offices and ours, we consult. Then we urge them to at least voluntarily, without compulsion, we tell them to stay in their home for 1 week, Mr. Speaker. That is the way to go. But we cannot also humiliate a honorable member who has just come, Assembly open, and then you ask him, you go back, that way we will not allow, Mr. Speaker, and compulsion is not allowed. Even there is no compulsion in religion. Why will you force a honorable member who is the one to, fulfill his responsibility in this house? You cannot tell him to go back or her. So with consultation of the Speaker, we will urge our honorable members who are coming from areas considered high risk. When they come, we will just urge them to stay 1 week at home without whether test or not, but they have to stay at least 1 week. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, I also concur with what Honorable Yaqub and Kula have said on the issue of testing. I think, Mr. Speaker, testing, according to me, is among the discipline that we need to follow at this time of coronavirus. Mr. Speaker, we are all aware of what is happening in our neighbors. There are many people who are dying daily. It's only that, Mr. Speaker, there are no much testing in Mandera. God forbid, we don't know what we, even ourselves, leave of those ones who are in Nairobi. Even us who are in Mandera, we don't know if we have it or not. We are at risk, Mr. Speaker. So, let the testing, if the testing is done, let it be done for the whole assembly, because according to the guidelines, I have seen that only 24 members were allowed to sit for the sitting. And as we are seated now, we are almost 16. So what we are lacking are few. So maybe those ones are in town, Mr. Speaker, and I don't see the reason as to why you tell those members who are in Nairobi to travel all the way from Nairobi to just to come and transact the business, while those ones who are in Mandera maybe are enough. So, Mr. Speaker, let everybody voluntarily suggest the idea of testing so that we know who is who. Thank you.
Thank you, Mr. Speaker. Mr. Speaker, I think the issue of this pandemic is of great concern, and it is disturbing the minds of the superpowers and also the mind, those who don't have powers, like other countries, small countries like Africa. Mr. Speaker, having said that, the issue that has been raised, Mr. Speaker, by Honorable Kula is of concern, and I think we will not subject only the testing to those members who are coming from Nairobi, Mr. Speaker. Mr. Speaker, Mandera itself, with now bordering Somalia, which is also high-risk areas, Mr. Speaker, we ourselves who are residing in Mandera are not safe, Mr. Speaker. Mr. Speaker, I think it is better and proper for us as an institution to do mass testing for all our members and staff, so that we're going to have a situation that each member knows who is who has tested positive or who has tested negative. Mr. Speaker, there is a misconception that we need to clear it out, Mr. Speaker, on the issue of the kits that has been used, Mr. Speaker. Mr. Speaker, Honorable Adan said that the kits might test positive while you are negative, or it might even test negative while you are positive. Mr. Speaker, that issue has been clarified by the DG the other time on television, and he said those kits are the rapid test that has been used by the Tanzanian government. It is not the kit that is being used at the Kemri and other laboratories in Nairobi, Mr. Speaker. Mr. Speaker, if it were that the positive person contains negative, the test that has been carried out in Mandera, 194 samples that has been collected from here, could not have all become negative, Mr. Speaker. It could have been, what do you call, otherwise, Mr. Speaker. Mr. Speaker, having said that, I suggest that we all come up with a proposal that we do mass testing for our staffs and members as we come back to an institution and do our business. Mr. Speaker, having said that, I say thank you.
Thank you, Mr. Speaker, sir, for giving me this opportunity to contribute to this issue of pandemic. Mr. Speaker, sir, some of us, we know that there is this issue of dengue fever, which has been in Mandera for so long time. And some signs of the dengue fever and this corona are almost similar. Having fever, headache, body aches, these are the same. And still it cannot be clarified. Somebody may be having headache this morning, even now, and he doesn't know whether it is a corona or not, or whether he has headache or he is getting fever. These things now, if it is testing, I suggest that there should be a testing area here, and every week should be testing, because every time we are getting a problem with somebody having headache, somebody having Panadol, maybe he takes a Panadol just to say I have a headache, and he's getting these fevers out of fear. And then if such issues are there, The testing of done once, and we sit and say, no, we are free from corona. And then next week we can still have corona. We don't know. So the issue is, first we give ourselves to God. This is a disease which is there, it has come. There's only God who can save it. Next we test after every week. We better do that, because if we do once and we still stay, and every morning some people can contract this thing. We cannot stop it. It's a virus which is spreading. So situation should be a bit more than just saying voluntary. It should be mandatory, and it should be done after every week, so that the business of this can continue. Thank you.
Member for Galalio confirm whether he's among those who have been told to stay away because of age 58 years and above. We need a confirmation from the Honorable Rafat to confirm to the House his age, so that at least we are safe. He is safe, actually.
Mr. Speaker, I think the age factor has been disapproved, because if you look at the statistics around the world, the people who suffer most from corona and who die in huge population, I mean the percentage, are people who range from 15 years to 59 years. 15 to 59 years. The 60 that was initially suggested. You are not watching the news, Mr. Diakob. You are just from the bush. You are just from Tergala, you are from the bush, my friend. The news, the national news says, that is the fact from the news. Thank you so much. And
Mr. Speaker, it is a national guideline. It's not something whether we follow or we are not going to follow. It's a national guideline. Even the Speaker's rules say so. And I'm not there also.
Thank you, Mr. Speaker. Though I came late, but from the statement of the House, at least I'm getting the perception regarding the COVID, the corona issue. Mr. Speaker, I think Mandera and Nairobi are both affected zones, red zones, and any honorable member that travels from Nairobi to Mandera with the permissions to come and attend the sessions, I think the guidelines are very clear. We need to observe precautions in terms of temperature testing, in terms of distancing within the house, in terms of hand washing if needs be. I think we need to observe precautions. If the house can accommodate the number that it can accommodate, then we look at first come, first serve in terms of attendances. If you are willing to attend, then others can also be attending, but at least you observe the quorum that is required within the house. I think we should not subject our honorable members to various stresses for coming from Nairobi. Equally, we in Mandera, Mandera is a red zone. So I think it's necessary that already now everybody is facing, wearing the face mask, hand washing sanitizers are there, the distancing is there, the temperature being, the temperature taking is there. So I think that is the basic essential precautions that we need to take. With that, I say I really...
I think all your concerns are very genuine. Honorable members, the guidelines provided by the Ministry of Health is very clear. And actually we observed most of it, including the taking of masks, keeping distance, and not gathering in public areas. Honorable members, the statement that raised Honorable Kula is also very genuine, and we will give a clear direction in our next session. The issue of age, I think Honorable Rafat is a good leader who observes the Constitution and is always abiding the law. And I think he could not attend this session if he is above the age of 58. I think he's under, maybe he can confirm to us. Honorable members, we go to the next order.
Order number 8, motion. Order number 9, bill.
Honorable members, having exhausted our today's business, we adjourn our house to today afternoon at 2:30 p.m.